Thank you, Mr. Chairman. The Affordable Care Act makes sure that when you buy something called health insurance, that it's real and not just some junk plan that isn't worth the paper that it's printed on. Your plan has to cover now mental health problems and maternity care and addiction treatment. It can't limit how many chemo treatments you get. And every plan has to cover a share of average out-of-pocket costs. So silver plans, the ones that most people buy, that share is at least 70%. And those are huge steps forward in the insurance market. But a lot of families are still paying a lot of upfront costs before their insurance kicks in. And many silver plans, for example, have very high deductibles. So when you visit your primary care doctor, you write a check. When you get a biopsy, you write a check. When you have a mole removed or you get minor knee surgery, you write a check, you write a check, you write a check, until you've paid down your deductible and insurance starts picking up the tab. So, Ms. O'Toole, I want to ask you, in Minnesota's Basic Health Plan program for low-income families, insurers are required to offer plans with very low deductibles. Can you just say a word about why that's so important?
Yes, thank you, Senator. And we are really proud of our Basic Health Plan. It's been around for 25 years, predates the ACA, and then was certified under the ACA. It's called Minnesota Care. And that Minnesota Care covers about 80 to 90,000 Minnesotans who don't qualify for Medicaid. But are still very low income. So you think about a family making about $30,000 who could be exposed to a $10,000 deductible. That's not doable for them. And so what Minnesota Care has done is allow these families to get the security of coverage and to gain, seek healthcare services for their families has been critical.
That's, thank you. That's really important to hear. In Massachusetts, one way we've made it easier for consumers to know they're getting a good deal when they buy their insurance is to require every insurer to offer plans with standard benefit structures so that it's specifically designed to have low upfront costs. And every person buying a plan on the exchange has this option available to them. Mr. Tyson, I know that in several states where Kaiser offers coverage, like California and in Oregon, they have the same requirement as we have in Massachusetts. You mentioned in your written testimony that standardized benefits can stabilize the market by making it easier for consumers to get coverage. I take it that means that offering these standardized plans hasn't limited your ability to compete for customers in those states if you can't charge for things like emergency care or an ultrasound as part of the deductible. Is that right?
That's correct.
Good. I'm glad to hear that.
That's correct, and I fully support that you end up really doing the work that's required to continue to look at how to drive down the cost of care,
right,
and building efficient systems to actually do that.
Right. Well, the federal government now runs the insurance exchanges in 28 states. They considered having the same requirement, but then they backed down and made this optional rather than required. Mr. Tyson, Kaiser also sells plans on exchanges that are run by the federal government, so where it's optional. If the federal exchange required insurers to offer standardized plans where some services fell outside the deductible, like emergency room care, would that harm your ability to participate in those markets?
We would still participate, obviously, because of our commitment. We would look at how to keep that as standard as possible across the program because we feel that that's vitally important for the person to have access into the care delivery system when needed. And we can show you the history over 70 years that if the person doesn't get the care early, you end up paying much more later downstream. In addition to that, the person is unnecessarily suffering a longer period of time.
Pay now or pay more later, plus all the additional suffering. There's just been a lot of talk that in order to stabilize markets and reduce people's costs, we need to go back to junk plans that don't actually cover much of anything. I think that is a bad idea, and so does my Republican governor who was here to testify last week. We need to be making it easier, not harder, for families to buy quality plans. And that means holding insurers to higher standards, not lower standards, as we do this. And I think we've demonstrated you can have competition that really helps consumers here. Thank you. Thank you, Mr. Chair.